You know, I'd like to make a pretty bold proclamation here today, and that is healthcare is really sick. In fact, I would suggest that healthcare is in critical condition.
Healthcare is very complex, and there's no way in a modern healthcare industry you can function on your own. Each cog in the wheel is so vital. If one of those cogs is loose, it's like a house of cards.
After years of researching and pondering that simple question, I believe the answer is yes. Yes, we can fix healthcare. I discovered an incredible big shift that must occur in order for us to avoid the massive collapse of our current hyper-interventional healthcare system.
Out as a technologist with over 40 patents, writing best-selling books on the topic.
Every day, I would wake up and find ways to invent stuff that I got paid for that treated sick people.
I've been involved in healthcare, traveling all around the world, sharing my ideas with some of the most esteemed audiences.
You know, as a young kid, I was always interested in innovation. I remember inventing my first meteorological instrumentation, and I really was excited about the fact that I got to participate as an innovator in healthcare.
I had the opportunity to travel to Dublin, Ireland, to share my ideas to the world about all that I knew about how the next bright, shiny object was going to really solve all the problems. And at the end of that presentation in Dublin, Ireland, I met Dr. Power. He came up and interrupted a dialogue I was having with 15 people and he said, Nick, it's about the patient.
It's interesting when people seek to differentiate between connected technology and artificial intelligence on the one hand, and the deep and meaningful relationship that physicians have with their patients on the other hand. They're two peas in a pod. The tech and artificial intelligence is a wonderful enabler, but it's not the be-all and end-all. It's that the foundation stone remains this deep and meaningful relationship between the physician and the patient.
After listening to his perspective, I began to realize that he was so right. There's really no way that we can fix healthcare without looking at the relationship between the caregiver and the patient. That's the genesis, that's the beginning of all the things that we need to do to really make healthcare work for everyone.
I think that there's an opportunity today to be able to reimagine healthcare in a way that's fair, in a way that is personalized and customized, and most importantly, safe and efficacious.